Hello everyone. Before I commence, I'd like to take the opportunity to respectfully acknowledge the traditional custodians of the many lands on which we live, work and learn. And I'd like to pay my respects to the First Nations people and their elders, past, present and future. Thank you for accessing this presentation, which is part of our Research to Practice series. In this session, I'll be sharing, by way of background, the landscape of what is known about sexual assault nationally and in Queensland, with a little of the current policy and service context. I'll also explore what the research tells us about best practice when it comes to responding to sexual assault. And this is particularly highlighting the demonstrated value of an integrated service response. Now, in the United States, an integrated response is commonly called a sexual assault response team model, referred to as a SART. And this has long been adopted in responding at a system level. I'm introducing the SART model now as a concept because in the latter part of this presentation, I'll outline the findings of some recent research we've undertaken at the Centre relating to a SART model in regional Queensland and tease out how our findings correlate with the broader evidence base. In starting, I'll clarify that I'm referring to sexual assault as any unwanted or forced sexual act or behaviour without consent, highlighting the fact that sexual assault is a crime. I'm using the term victim throughout this presentation, but I acknowledge the choice of those who have experienced sexual assault to identify with the term victim or survivor or as both. When we talk about sexual assault statistics, we must remember and acknowledge that sexual assault is a highly underreported crime. There's a number of reasons why the reporting rate is so low, and these include fear of being disbelieved, fear of retaliation, shame, self-blame, trauma, and unwillingness to recount the event or events that occurred. So, I'll emphasise again, statistics do not represent the full extent or prevalence of sexual assault in Queensland or Australia. But let's look at what we do know about those that reported sexual assault. We know that in 2018, the number of sexual assaults recorded in Queensland increased for the 7th consecutive year to 4,849. Approximately 1 in 5 women and 1 in 20 men experienced sexual violence since the age of 15. Most sexual assaults were experienced at a residential location, with over 2/3 of victims knowing the offender. And of course, this is very different often to the myth that sexual assault is often perpetrated by a stranger and in a place other than a residence. Internationally and in Australia, integrated responses are viewed as best practice. And this is for a number of reasons. The Queensland Government recognises the importance of interagency responses to sexual assault, and this is evidenced by the Queensland policy landscape, which includes key strategies and guidelines which inform initiatives in responding to sexual assault. So these include the Queensland Violence Against Women Prevention Plan, the Domestic and Family Violence Prevention Strategy, The Queensland Government interagency guidelines for responding to people who have experienced sexual assault. And most recently, the Queensland's framework to address sexual violence, which includes the words in the title, prevent, support, believe. Very true words. And I would encourage you to familiarise yourself with these documents. Now, let's look at literature, and it confirms that in bringing together various systems, a more comprehensive level of care can be achieved and provided for victims and indeed their friends and family who are supporting them. But there is inconsistent terminology to discuss integrated responses, and these include terms such as interagency, multi-agency, collaborative, integrated or coordinated. And the terms are often used interchangeably. But what they all have in common is they refer to a service system that goes beyond singular service provision. So at its core, integrated service responses focus on how service systems work together in a timely, structured, collaborative way to ensure service users receive quality and consistent support. In other words, having a joined-up response has benefits for victims. And I'll tease out why this is so a little more before discussing how this applies in the real world. It goes without saying that victims of sexual assault are going to feel a range of emotions, including shock, fear, guilt, shame, depression, and an inability to trust others. These emotions will manifest in a lot of different ways. The social stigma attached to sexual assault can heighten these feelings and increase the trauma experienced. So in absence of a joined-up response, it means victim must identify the services they might need and then be faced with approaching each one by themselves and individually. At the time of crisis, this can be overwhelming and individuals may give up, not report and not seek help. So the importance of post-sexual assault support is well documented and clear, and it is a significant factor in victim well-being, recovery, and their mental and physical health. So let's look at some of the benefits that are well documented. So it means for victims a more streamlined service journey without having to identify or contact services individually, as we've mentioned. This means they don't have to retell their victimisation event or events repeatedly. And this in turn leads to a lower risk of re-traumatisation. It means they receive full information and are more empowered with choice and having some control over the decisions they want to make. Now, a joined-up response doesn't just happen. So across agencies, there needs to be a consistent understanding of procedures and processes in responding to sexual assault across all the organisations to facilitate a timely response. There needs to be positive collaboration, enabling separate agencies to perform their defined roles at a high level without pressure to fulfil the role of other services. And such collaboration facilitates a more comprehensive level of care for the victim so that they are connected and have access to multiple services. Now we'll move more specifically to look at the SART model I referred to earlier. What is a SART? A SART is a victim-centred model. It prioritises victims' needs and respects their choices. It has a focus on an interagency response that is holistic for the victim of the sexual assault. While SARTs have been widely adopted in the United States, there is no one standard model, with SART implementation varying from location to location. Despite some variances, they all include a multidisciplinary team from health, a sexual assault specialist agency, and representatives from the justice system. So we'll now look at our evaluation of a SART, and we were particularly looking at the specialist sexual assault service role within the SART. And through this, we're able to describe the outcomes and evidence of a SART model operating in regional Queensland in terms of a best practice response to sexual assault victims. In our research, the SART we evaluated included a specialist police unit, specialist sexual assault service, forensic nurse examiners, and representatives from the local hospital. Our evaluation used a mixed methods design. This incorporated a desktop review of governance and operational documents, an analysis of the data collected by the SART members, and this was because they had developed a shared database that each agency contributed to. We also conducted focus group and individual interviews with the SART representatives and also victims. When we analysed our data and compared the key aspects of this Queensland SART with other previous research, what did we find? And in looking at this, I'm actually sharing the logo developed by the SART in the case study because we found they did indeed demonstrate the elements contained in this logo. And these elements are regarded as best practice. In other words, it did embody the evidence base. There had been tangible relationship building. Workers did engage in reflective practice. Most importantly, victims spoke to the integrated care they received, and the whole model maintained a victim-centeredness, committed to a victim's choice, safety, rights, and control. So these were not just words, they were enacted. But behind such a logo is a lot of hard work and years of investment in relation building. It doesn't just happen. So I'm going to explore the key elements a little further to illustrate what is needed in looking at an integrated response that is effective. We found ingredients for success included joint recognition that each member played a specialist role in their particular area, and when combined with others, an enhanced holistic response to victims could be provided and was provided. There were simple and easily understood referral pathways. Keeping the referral process effective but simple was seen as important, with victims only having to present at one place to one of the agencies for the SART pathway to be automatically activated and implemented. There were policies and protocols in place, but these were not static and they were influenced by partner and victim feedback, and this underpinned practice across the team. There was collection and management of accurate and reliable data by way of the shared database that I referred to earlier. There was a dedicated coordinator role that supported the SART. And while it wasn't a full-time role, that position was seen as the glue that helped make it work. So the coordinator ensured that the mission and purpose of the team was held front and centre at each meeting, and that issues and the positives were also fully discussed. So drilling down, this meant that minutes taken were quite extensive as opposed to dot points, so there could be reflection and continuous improvement. And importantly, there were trusting professional relationships, with each respecting the other's role, and that each was a very much needed facet of the response. Additional characteristics we also found that made for success included each SART member was authorised, resourced, trained and supported by their agency to act as an acknowledged decision maker. There was buy-in across all the SART agencies to the shared vision and purpose, and actions were grounded in a trauma and violence-informed care framework. Members were experienced and trained within their specialist area, but also in the SART principles, protocols and terms of reference. Each member agency responded on a 24/7 basis, enabling an immediate wraparound response for the victim and seamless referral and information sharing between agencies. And this supported a wraparound support for victims, both at the crisis end for recent reports, but also in an ongoing way through the Sexual Assault Specialist Agency. Coordination, review and reflection mechanisms were in place supporting ongoing review and improvement. And the continuity of members in this particular SART was also a valuable characteristic. But what was also revealed is if representatives change, it was important they had good induction so that, again, things moved smoothly and everyone responding to a sexual assault report had a similar understanding and purpose. And so to my conclusions, what did we learn about the model operating in our state? Well, quite simply, that a SART approach makes a difference in the lives of victims. I've just put up a very simple quote from a victim, but the messages from that are reflective of a very strong theme from all those we interviewed. In a nutshell, wraparound support at the point of reporting, along with being heard and believed, cannot be underestimated, the difference it makes. Specialist sexual assault services can provide support in an ongoing way, in a way that other agencies such as police cannot. And this too is a critical component on walking alongside the victim. Each agency has their place. Thank you for watching this presentation. I'm leaving you with a reference list which helped shape this presentation, and our email address should you wish to know more. And please contact us if you do have any questions. And a last thank you for making the time to learn more about this critical area. I wish you well in your work. Thank you.